So at the last ASH meeting, we have presented some data regarding the use of Inotuzumab Ozogamicin, which is an anti-CD22 antibodies conjugated with the calicamycin in the setting of relapsed refractory acute lymphoplastic leukemia with extramedullary involvement. We all know that the extramedullary disease in ALL is not so unusual finding, and unfortunately the outcome of these patients is very, very poor. So together with other sites in Germany, in Italy, we have collected in a retrospective analysis some data regarding patients with ALL and extramedullary disease which have received Inotuzumab Ozogamicin. The extramedullary involvement was detected in many sites, various sites such as lungs, ovarian, muscles, and other places. Overall, we have studied 31 patients with relapsed refractory extramedullary ALL with a median age of 31 years, who were treated from 2015 to this year with the drug, which was obtained as a compassionate program use or in label after FDA or EMA or IFA approval were reached. All these patients had a CD22 positive acute lymphoblastic leukemia, of course, and they received at least one course of Inotuzumab at the standard dosage, which was approved by FDA or EMA or IFA. What we observed in terms of responses was with a median follow-up of 29 months, so a quite long follow-up. We detected overall a complete remission assessed by PET-CT after the first course in 10 out of 24 patients which were assessed evaluable for this kind of objective. 9 patients had a partial remission and 2 patients had a stable disease. And in 3 cases, we observed a resistant disease or a progression of leukemia. After 2 courses, CR rate was 55% and PR rate 29%. Globally, what we can say is that this kind of approach can give an important anti-leukemic activity, even if we know that it's not able to eradicate the disease, and an allogeneic stem cell transplantation is required in order to intensify and to consolidate this kind of response, because this kind alone is not able to cure definitely this kind of patients.